Evening everyone. By names of Achille Gloria from Victoria University, pursuing Bachelor of Nursing top-up, Faculty of Health Science, and my registration number is VU BNT 2603 2088 weekend program. I'm doing a video presentation on social psychology, and my topic is stress and coping up psychology. The aim of this is to explain the concept of stress and coping psychology, discuss major theories of stress, of coping up with stress, talk about the effects, causes, and how to manage stress, then make a conclusion. I started by defining stress, whereby I defined stress as emotional, psychological response that occurs when an individual perceives a situation as challenging, demanding, or threatening. Stress can be positive or negative. In positive, I can explain positive stress as something which motivates an individual to perform, or a group of people to perform. For example, if students are going for exams, a student nurse is going for exams, will be motivated to read hard, hence getting more skills, and due to that stress, it helps the student to gain more knowledge. Then negative stress. This occurs when the demand exceeds person's ability to cope up. And this one leads to anxiety, frustrations, and some health problems. I went ahead and talked about the types of stress, whereby I found acute stress. There's acute stress. It can also be named as short-term stress. This one comes immediately. It's an immediate challenge. For example, students become nervous when they are going to do exams. They get nervous, they read hard, and when the exam is done, the stress goes out. There is long-term stress. The long-term stress can also be termed as chronic, whereby this stress persists. It persists over time. For example, during financial difficulties, conflicts in families, and there are many causes of stress. There is heavy workload. If you're having a lot of work, for example, as a student nurse, you find you have to work on patients, you have to order drugs, you have to do reports, and attend many patients due to all that work. You find someone is overwhelmed and ends up getting stressed. Academic pressure. In terms of exams, in terms of presentations, in terms of courseworks, there is a lot of pressure because you're worried of marks, you're worried if you're going to catch up with time, if you're going to meet the deadlines. So due to all of that, you find you are on tension. Then relationship problems. This happens in marriage, in whereby sometimes you can get conflicts, you are not understanding each other, you are having misunderstandings, and due to all that, it brings conflicts and you find you're disturbed. There are environmental factors where such as noise, overcrowding. In overcrowded places, someone cannot feel comfortable when you are in an overcrowding area. In a noisy place, someone cannot rest when noise is too much. For example, people living in slummy areas, it's hard for them to have a comfortable life, so they end up getting stressed. I will go ahead and talk about theories. I came out with two theories. One is Hans-Tille's general adaptation syndrome. This type of theory responds in three stages. There is alarm, resistance, and exhaustion. In resistance, the body attempts to adapt to cope up with stressor. You find someone can be able to cope up with the cause of stress. Exhaustion stage continues for a long time. Body response, body's response become depleted, leading to illness and fatigue. Then Lazarus and Volkmann's cognitive appraisal theory. It depends on how somebody interprets a situation. Most people react differently to stress. There are some who cope up very fast. There are some who understand it very fast and they are able to come out of it. And there are those who take long to cope up with the situation and they end up suffering. Effects of stress is physical stress, psychological stress, and social stress. In physical stress, someone gets headache. Find someone complaining of headache, I have too much headache. And what is causing that headache is stress. People tend to get high blood pressure, sleeping disturbances. You find you go in bed, you cannot sleep because you have a lot on your head. Then psychological effects, they normally get anxiety, you get depressed, low mood, you don't want to do anything, you're just there. Poor concentration. Due to stress, someone tends not to concentrate a lot because the mind is disturbed. Irritability. Social effects, there's conflicts with the family. You find someone having conflicts with family. Reduced work performance. When you're at work, you cannot perform well because there is a lot on your head. There is a lot disturbing you. Social withdrawal, you withdraw from the society and find someone not willing to be near other people. There is stress can be managed in different ways. You can manage stress through effective strategies which include time. Always be on time. For example, a student in exams, you read before the time of exam so that you have confidence in exams to avoid stress and nervousness. Then natural physical exercises in the case of illness, in the case of Then getting adequate sleep. Get enough sleep. Wake up when you're sober and be able to do other work. Seeking social support, that is going for counseling and getting support from other people. Then health and nutrition, peer support groups, prayers. Prayers have helped people a lot. Every time you have stress and they go to friends for prayers, comforted in prayers. And concluded, stress as an avoidable part of life, especially in health. Professionals such as nurses, it's hard to avoid stress because you find when you're on work, you have to face very many people and who needs your services at the same time. Then stress module provide vulnerable insights into how stress develops and affects the individuals. That is the end of my presentation. Thank you very much.